respiratory therapist.
I am a holistic health practitioner.
I'm a physician here in Edmonton, Alberta. I work in pediatric immunology and infectious disease.
I'm actually a shit disturber trapped inside of an artist's body.
I'm Tania McDonald. I work professionally as an agriculture research tech.
My name is Marco Manarino. I'm a family physician here in Edmonton.
My name's Noah. I'm a registered nurse working out of the Northeast Emergency Room.
Most of the response for COVID has been clinical based or economic based. So when you know what I mean by that is the clinical response is, physical distancing, wear your mask, get your vaccine. And the economic response has been the economic response, right? COVID relief for businesses, support payments for people who lost their jobs. And yet what the governments and the powers to be, what the leaders forgot to consider is the cultural response, the behavioral change, the impact on mental health.
In addition with COVID, there's also kind of this, you might hear like the shadow pandemic or kind of all these different terms to describe essentially people being too afraid to seek medical care. So they don't want to go to a hospital or don't want to go to a clinic, but they actually have like significant health issues going on. And so we've noticed that, this was more sort of earlier in the pandemic, that people were very afraid to go to their doctor. And as such, they just let health issues brew until they got to the point where they were very sick.
Vitamin D supplements can prevent or even help treat COVID-19.
I would say true.
Vitamin D cannot prevent COVID transmission. You just can't do it.
The easiest answer, looking at it one way and the other, is true.
False.
I love vitamin D, but I'm going to say false because prevent is some strong words.
False. I wish it was that easy.
False. We know that people with COVID-19 or have had severe illness with COVID-19 tend to have lower vitamin D levels, but that's likely just a reflection of their overall health status. But there's no direct evidence that taking vitamin D cures COVID or helps to prevent severe disease, other than just being part of a healthy sort of lifestyle.
But the reason why I say true is because I think healthy people have a much lower rate of infection and much lower rate of death, but we are still carriers. And that's where it doesn't matter if you're taking vitamin D, it doesn't matter if you're running every single day. Yeah, you might not get it, but when you go home to your grandma, she might get it from you.
The numbers around vitamin D is polling and illustrating that there's a high percentage of people who are vitamin D deficient when it comes to having COVID.
Vitamin D doesn't hurt anyone. I mean, we all have a little extra melanin and we live up north, so we could all use some vitamin D, but it's not that easy. Diving
into some of the literature around things, it's tying into now how vitamin D is beneficial for the gut. And there's a term that's kind of being loosely tossed around because it's something that is so new around science, is the microbiome. And microbiome, what does that kind of entail? It's the bacteria in the gut. There's more gut bacteria in our gut than there is cells in our body. So now what happens? How do we conceptualize that? How do we make sense of that? What does that even mean? And in various types of studies, it's tying into how vitamin D supplementation is now providing a greater amounts of good bacteria in our gut.
There's been numerous studies. The first studies that came out, there were a lot of people in the wellness industry that were very hopeful that vitamin D could help generate a higher immune response for people exposed to COVID and lessen their risk. And the first studies that came out weren't great, but there's been subsequent studies that have come out that have suggested that there could be anywhere from a 10 to 23% boost to your immune system as it relates to your body's ability to deal with COVID-19. The problem is all of the studies with vitamin D are just too limited.
Being metabolically healthier, regular exercise, healthy eating, a good mix of, it can help prevent you from getting COVID and getting sick.
I'm going to have to say false because the words are so strong.
I'm leaning towards true.
That's completely false.
I would say yes to that too.
True.
So false, unfortunately. That, again, like vitamin D, doesn't hurt, never hurts to be active and eat healthy and exercise. These are good things to do for your health overall. But in order to decrease transmission of the virus, the only evidence-based things that we have are distancing, hand hygiene, and vaccination.
First of all, what can it hurt having a stronger immune system, which we all know is proven to be brought forth by being healthier and more active? I don't think it prevents COVID, but I think it will definitely help you in the fight if you do get it.
It just goes back to being healthy, being active. You will not get it. You will be okay. The whole reason why we're having all these lockdowns, why we're having all these quarantines, is so that we don't overwhelm the hospitals, where the hospitals are not able to give adequate care to the patients that are there, which 90% will be people that have other comorbidities.
You can be the fittest person in the world, and if you're exposed to the virus, you're going to get the virus. And here's the thing that pisses me off, honestly. We have these healthcare experts, they're doctors that are jumping on social media, that are beating people up with respect to the body's immune system and its ability to fight COVID.
It's false, but it won't help prevent you from getting COVID, because the risk of that is just based on your risk of exposure. But it will strongly prevent you from getting severe disease. So we know that the healthier you are, better lifestyle, better aerobic fitness, et cetera, that is strongly protective against severe COVID disease. So long story short, won't prevent you from getting COVID, but it will help protect you from getting really sick with COVID.
There's a guy out there that, talked about hockey players, professional hockey players, some of the fittest athletes in the world. And even though they're fit, they still got COVID. So yeah, but how many of them died of COVID? How many of them had a severe reaction to COVID? Because of their high immune function, overall, general population masses, if you have a stronger immune system going in and you're exposed to a virus like COVID-19, the research is starting to show this, your body's ability to fight the virus is going to be higher than someone that has a pre-existing condition.
Wearing a mask, it's going to increase the amount of carbon dioxide that I actually breathe. It's going to make me sick.
I'm going to say false.
That's false.
False. How many decades have doctors and nurses worn masks in the operating room?
That's false.
You're just stepping into false world. That is very incorrect.
And that's false. I will acknowledge that wearing a mask is uncomfortable. I have to wear one all day at work. But the reality is that masks help prevent big droplets containing the virus from basically kind of being expelled out of our mouths and into the air to make other people sick. But the droplets are relatively big compared to oxygen and carbon dioxide. So obviously oxygen is O2, so two molecules of oxygen. CO2 is carbon and two molecules of oxygen. Whereas the virus is, tens of thousands to hundreds of thousands of molecules and, genetic material and stuff like that.
No, so again, false. Pre-pandemic, I would wear masks all the time, and if you wanted to check my sats at the end of the day, I was fine.
Those individuals that are very concerned about the carbon dioxide that is being produced are the very individuals that should be taking COVID very seriously and working on their overall health so that they don't get COVID. And doctors and nurses and surgeons wear masks for a prolonged period of time, for years, and they're fine.
COVID-19 is no worse than the flu.
That's false.
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 That's false.
That's false, as it stands now. We know that just from the typical seasonal flu that COVID is probably 4 to 10 times deadlier. So the mortality rate is 4 to 10 times deadlier.
Yeah, so again, false, but I'll give the thing is that the flu is also bad. You know what I mean? They're both bad viruses. The influenza virus can kill healthy humans, and it can cause long-term immune system effects. And it's a bad virus, and we don't want people to get influenza.
I work for the CDC contact tracing with AHS, and one symptom that we see a lot is people have loss of taste and loss of smell. This is new. You don't see that with the flu. You don't see that with the regular flu. It's quite scary. I think a lot of people, they lose it for a long period of time. And for some people, I can't speak to it 100%, but I've heard that in some cases, it takes a long time to come back.
But the flu can be very dangerous as well, especially influenza A. So it's not a matter of it being better or worse. We need to take it seriously and position ourselves to weather the storm.
If you're being affected by the flu, and if you're questioning where the flu is, and if you're questioning where the numbers are for the flu, and you're not more concerned about what you can do to prevent the flu and to do something about mitigating and decreasing your risk around either the flu or COVID for not only yourself, but your family, your friends, those closest around you, your immediate circle of association, then you're asking the wrong questions. You're missing the point of what's happening here. This isn't something to speak about and to gossip about. It's something to make change about and to do something about.
And the reason why COVID is worse is that it's more infectious, and it's something where we don't have a good medication for. It's much more transmissible. It's novel. People seem to be dying more from it, and we don't have a good, really good treatment, antiviral medication that's very widely available. So
We can achieve herd immunity by letting the virus spread through the population.
I mean, we could. Do we want to do it that way?
Easy answer is false.
The idea of achieving herd immunity by letting the virus spread is very, very dangerous.
So the question about, can we achieve herd immunity by letting the virus spread through the population is actually true. But at what cost?
I want to say false to that.
I would never, even if we were talking about chickenpox, I would never subscribe to that way of thinking.
Technically, yeah, it's true. If we don't have any lockdown measures, and we would probably achieve herd immunity pretty fast, but we would also lose a lot of lives and probably cause a lot of morbidity. And so that argument maybe had a little bit of weight at the beginning of the pandemic when we didn't have anything else to achieve herd immunity other than natural infection. But right now we have effective vaccines, and so we have a much, much safer way to achieve herd immunity. So that is the best way to achieve herd immunity and the safest way right now that we can achieve herd immunity. So
You're dealing with the virus again. As per my earlier question, you just don't know enough about it. Sure, it might only affect 3-5% of the population, but again, we don't understand the long-term impact of it.
Herd immunity is achieved if we allow the greater population to be infected while being vaccinated. It also allows us to let a certain population percentage die from the virus. Are we willing to let that happen? And are we okay with a certain population wither away because we want to open things up? That's a really tough question. We can't answer that. I can't give you a definitive answer on that. That's for the politicians to decide. But from a humanistic standpoint, of course not. We don't want that. I don't want to put my grandparents at risk. I don't want to put my father at risk who has high blood pressure. You never know what the smallest infection can do. But in terms of herd immunity, I think it's another excuse to say, screw it. Let's just open things up. Let's see what happens. Let's see how it goes.
we don't have long-term data. Of course we don't, because these vaccines are new. There was an unprecedented amount of effort to get these vaccines made, which is why they've been made so fast. Like, there's never been this amount of time, resource, money, scientific knowledge put into any vaccine. I don't think in recent times, and so that's why they were developed so fast. And of course, we don't have that long-term data. We won't have that until there's been more time. But the one thing that we do have is a lot of a large number of people who have received the vaccines. So when vaccines are initially tested, it takes a long time to accumulate the number of people for a trial, because you're trying to get people over a long period of time, and you slowly recruit people. Whereas with this pandemic, because it is the forefront of, it's a global crisis, we were able to accumulate a lot of people to get the vaccine and get a lot of people to get vaccinated, and a lot of data from a large number of people fairly quickly. So there is really good evidence. It's not long-term. Of course it's not long-term. We've only had the vaccine for a few months, really. So yeah, but there is a large amassed amount of data, which is quite good, and that's where all those safety recommendations are coming from. And so that's why people feel very confident about those safety recommendations.
I think what COVID-19 has shown us as a society is who we really are deep down inside, what we really hold true to ourselves, and what is important to us. I think we need to be more holistic. We need to come together to get this thing done.
COVID will never go away, but, think about it this way. This was a virus that our species, humans, have never been exposed to, and this is sort of typical. And as much as this was sort of a traumatic experience for everybody, that the reality is that pandemics actually aren't that rare, or there's a pandemic declared every few years. So I think hopefully we can kind of take away some things from this one. And ultimately, I think the biggest thing we can take away from this one is just, let's learn to care about ourselves and care about each other a little bit more. And sometimes it takes kind of adversity to kind of draw people together more closely, and that's unfortunate. But, we went through this. Let's not lose that kind of goodwill and spirit and stuff towards each other that we've developed over this tough past year.
I think it's important, like I said, part of my job as a physician is to be an advocate and to help the public in general understand some of the medical decisions that are being made in the public sphere. And really, I think the main message I want to do is that a lot of people think that, there's this big, the us and them between healthcare professionals and the public in general, or the way people making these decisions, but it isn't. We're all literally in this together. I want this pandemic to end. I want to hang out with my family and my friends and go to weddings again and go on trips. We all want the same things. It's not an us versus them. It's us together trying to get through this together.
I liken this to kind of the collective experience with COVID, because it feels like someone else is running the show. Like you don't have control. And sometimes we have to dig deep and really look at what we do have control over. And sometimes it's just our mindset. It's just our perspective. And I guess one of the biggest things for that perspective is not to just always think positive. Allow yourself to be human and to cry and be sad and have a moment. Because to experience the highs in life and the joy, you also need to experience the other end and the lows to appreciate them.
You're in ultimate control of yourself no matter kind of where you're at. You position yourself at this current moment in time. There's no ability to go back to change anything that has happened. There's no ability to re-influence or change the direction as to how things are going to happen, but you're able to do so in the present in navigating the moments that you have and redirecting yourself in a different degree of angle towards a higher version of yourself.
My kids wear a pink t-shirt every year on No Bullying Day and says, "Be kind." I think we should all just walk around in bright pink t-shirts telling each other to be kind. I was yelled at in a grocery store because I went the wrong way on an aisle. The elderly gentleman would have been passed by me if I had went behind him anyway, and I probably would have gotten closer. And I just stood there and I said, just be kind.
Biggest lesson in my life, and I'll close with this. When my mom died of cancer, my uncle gave me a card and he said, you do what it said on the card, you do what you fear most and you control your fear. Do what you fear most in life, but control your fear. And there was a lot of fear when COVID-19 hit. And yet there was no control that was put in place. no one gave us humans tools to help control our mental health, to really, do the due diligence on controlling the clinical side of things. It was just too wishy-washy. Yeah, well, masks are important. Now they're important. Now they're not important. Oh, you should wear them even if you've been double vaccinated, or maybe not, like they are in the U.S. If there's something you fear, you got to get control over it. You got to deal with it until you know what it is you're dealing with. So, yeah.
What's going on, guys? I hope you guys enjoyed that theatrical episode. Thank you so much to our guests, to our featured guests, and I hope you enjoyed the episode. Kenny, you got anything to say?
Wow, I just want to say that what we just did there was something that we felt we really needed to do, and we appreciate every single one of you for taking the time to watch our video and as well be more well-informed with the information that has been provided to you now based off of everything related to COVID-19. So we hope that you have a little bit more clarity as to what you need to do right now to continue to be safe, as well as huge shout out to every single one of our health professionals for taking the time out of their day to give us this knowledge.
And that's a wrap, guys. We'll see you next week.